Ma'am, we shall start. Good evening, all. I'm Preeta Harikrishnan, Deputy Manager Admissions, Amrita Health Sciences Kochi campus. I'm happy to welcome each one of you to this webinar today. I'm also here to provide you with the official introduction of our guest, Dr. Usha Menon, ma'am, Clinical Professor from Amrita Institute of Medical Sciences, Endocrinology and Diabetics Department. Madam is a respected and esteemed member of the department, specializing in diabetic sciences. With her expertise and knowledge in the field, she is dedicated to providing valuable insights and information, as well as guiding and supporting individuals interested in the course. We are honored to have her with us today to share her expertise and address any queries you may have during this special session. I'm pleased to extend a warm invitation to Dr. Usha ma'am to enlighten all the attendees today on the scope and various opportunities of diabetic sciences. Welcome, ma'am.
Thank you. Am I audible?
Yes, ma'am. Yes.
So, a very good afternoon to everyone. Just share my screen. Yeah, is my screen visible?
Yes, ma'am.
Okay. Okay. So, greetings from the Department of Endocrinology and Diabetes, Amrita Institute of Medical Sciences. I really welcome all of you and I'm really thankful that I can share some valuable information about a course probably you have not heard a lot about. So this course BSc and MSc in Diabetes Sciences is offered by Amrita Vishwavidyapeetham University, which probably you already know that that's been ranked about among the top 50 universities in the world. And it is probably it's ranked as the fourth best university in India. So the Allied Health Sciences Division of this university is located in the Health Science Campus, Kochi. That's where we are all located, Amrita Institute of Medical Sciences. So basically, BSc Diabetes Sciences and MSc Diabetes Sciences are health science degrees. And the main aim of this course is to train diabetes educators who would assist doctors in their clinic in managing diabetes patients. There are many courses which are focusing and training diabetes educators as such. Probably some of them are like distant education courses. Some are like 1-year training courses, diploma, certificate courses, etc. But the unique feature of this course is that this is a health science degree, on top of which you can do an MSc, MPhil, and PhD, or any other courses. So this will serve as a graduation as well as a health science degree. So the diabetes educators, probably many of your family members have diabetes, and some of you might be aware that when you go and see a doctor may not get much time to talk to the patient. So there may be a diabetes educators who will be doing all the talking, discussion, counseling, guidance, etc. So this has been practiced for more than 80 years in the West. But this system has become common in India only probably since the last 2 decades. So that's why probably you don't know much about this course. However, I'll tell you briefly little bit about diabetes so that you know the background of this course. So diabetes, that is the condition where your blood glucose goes higher than normal. That is considered as a metabolic disease. and it is a global health problem because about 422 million adults in the world have diabetes, and that is 1 in every 11 adult is known to have diabetes. And the second thing is that it's on the rise. So the statistics shows that the number of patients having diabetes is steadily increasing, and it is projected to grow in multiply in geometric proportion, and it is expected to be 700 million by 2045. So it is a problem which is increasing all over the world. And the important thing is it's considered as a silent killer because it may not produce many symptoms. And finally, it is leads to death due to various problems. So it is considered as the ninth leading cause of death in the world. And about 1.5 million deaths are caused by diabetes in a year. So that's the global scenario. So let's just look at what is happening in India. In India, the same thing is happening. That's the number of diabetes patients are increasing, and you can see the difference. All these red areas are the one with the more than 12 percentage prevalence. That is, if you take 100 people, 12 of them are diabetes. Having diabetes. So if that was only two, three states in 1975, now it is becoming more in 2040. And if you take a statistics now, more states might have reached this criteria. So it is said that if you take the total diabetes patients in the world, 1 in 6 of them will be an Indian. So this is a major 77 million adults in India already has diabetes. And there are many types of diabetes. I'm not taking a class on diabetes, but I just want to give you an overview of diabetes. There is a small percentage of patients have type 1 diabetes where they need insulin for their survival. And whereas type 2 diabetes is the major chunk at 90 percentage, and they can be initially treated with the oral medication. Then later on, they may end up in insulin. And gestational diabetes is a peculiar condition that happens during pregnancy and disappears after delivery. And this diabetes is called a silent killer because initially it may not produce any symptoms, but it will keep damaging our internal organs and finally results in small and large blood vessel disease, which results in stroke, that is weakness of one side of the body, or blindness, or a heart attack, or a kidney failure, and loss of sensation in the feet, which results to non-healing ulcers and infection and finally end up in an amputation. So even though I'm saying it is a bleak picture I'm painting, but it is not the truth because you get enough time to prevent all this. That's the most important thing. That suppose the diabetic patient starts having diabetes, their feet might be looking like this. If they don't take care of their diabetes, later on it will they'll develop peripheral neuropathy, that is damage to the nerves, causing changes in the foot. And finally, the shape of the foot changes, sensation changes, they get chronic ulcers, they may lose toes because of the infection, and finally, they end up in an amputation. So, the most important thing here is that it is preventable. How do you prevent this? Through educating patients, because if they knew that this would have happened, they would have taken ample precautions to prevent this. So you need to educate the patient. So unlike any other disease, when you have a diabetes, you need to learn about it. We say that you need to be a half doctor to manage your diabetes. And diabetes management, probably you might be seeing some of your family members having diabetes. They have a lot to do. They need to watch what they are eating. They need to follow diet guidelines. They need to do exercise and they need to monitor the blood sugars. They have to keep track of their activities and they have to go for frequent checkups and they may need to take medications orally or injections as insulin. So 90 percentage of the diabetes management is in patient's hand, even though the doctor can be a guide for the treatment. And this is 24 hours a day, 7 days a week, 364 days a year, and it's a lifelong process. So, how do you just imagine what all things a patient need to know, that they should know about the diabetes, how to plan a meal, how to monitor, how to do exercise properly, when to take medications before food, after food, and how do you know when the sugars go up or down and what to do then, and how to take care of their feet, how to look after the skin, how to, and they need to know what is the risk of having certain problems, and when they, if they are vomiting, they're taking this tablet, what will they do, should they, a lot of things they need to learn a lot. And there are a lot of gadgets which we use in the treatment of diabetes, like insulin pen, insulin injections, and glucometers. And then there are newer technology. With advanced technology, we have continuous glucose monitoring system. That is a small electrode like thing which is stuck on the skin, will keep on measuring the glucose every 15 minutes, and this will be sent to this monitor or to your Android phone, and you can see it as a graph, and it will even give warning if the sugars are going low. And there are insulin delivery system called insulin pump, which will keep on delivering insulin into the under the skin. And there are now the advanced 780G pump where these two are combined, and this monitoring device is sending messages to the pump, and according to that, pump is delivering. So all these newer gadgets and technology has made the life of diabetes patients very easy, but it is very difficult to master this technique without the expert help and advice. All these are done by the diabetes educators, because the doctor cannot do all this. He has a busy OP, he has so many patients to see. So all these needed thing which the doctor has to do is currently done by the diabetes educators, because they are the center pillar of diabetes care team, and they are in constant touch with the patients and the family, and they keep on monitoring them, guiding them, supporting them through the journey of their living with diabetes. And the most important thing is, even in the middle of the night, they may call and say, my child has a low blood sugar, what should I do? Now he is not responding to giving glucose, then you can help somebody. And there are people who need to be constantly reminded of their checkups, and also need to be refreshed about their insulin technique and all those things. So there is a lot an educator can do to make somebody's life happy, peaceful, and comfortable. So that is the major role of diabetes educators. And they are the nodal point where the patients can contact, and they work together with the families and the doctors and other specialists who deal with the diabetes. So they are the base of the diabetic care team. The important thing to know that World Diabetes Day in 2021, the theme was access to diabetes care. And this they emphasized this because they said not all patients have the luxury of having a service of a diabetes educator. And worldwide, only half of the patients get this opportunity. This is because of lack of trained persons to provide diabetes education. You can see that because of this lack of trained person, many people take some nurses and they give special training to them to look after these patients. Most of the diabetes educators previously were trained nurses, but now we do have this course. Many of these we have been conducting this for last 2 decades, and all those who are passed out have been immediately got a job as an educator, because there is a dearth of these trained personnel. So now coming to the degree as such, it is a graduation BSc and post graduation is MSc Diabetic Sciences. We didn't name it as diabetes educator course because there is a background of research also you get in this course. So the duration of the program is 3 years plus 1 year internship, where you get hands-on training with all these devices and patient support. And the eligibility is passing plus two with 60 percentage aggregate marks in physics, chemistry, biology, and English. And admission is based on Amrita entrance test. Now, the syllabus basically it touch upon many of the topics which are dealt in MBBS curriculum, like anatomy, physiology, biochemistry, and as well as computer literacy and English proficiency. And these are conducted by the Amrita School of Medicine. And during second year, you deal with pharmacology, pathology, but in the second year, you come to our department and where you get the basics of diabetology, pathophysiology of diabetes, complications, as well as education and psychosocial aspects. Third year, you get a deeper knowledge of diabetes and other specialties like dietetics or nutrition therapy, food care or podiatry, and biostatistics. Here, you also have to do a project and present thesis, and exams are done yearly, theory and practical and viva. And based on all this, you go to internship. Many topics covered according to the syllabus of diabetes educators. And during the internship, you get training on one-to-one counseling as well as group sessions and taking classes, and also in food care as well as nutritional advice. And since 2006, we have been conducting this course, and all those who have passed are employed either in India or abroad. So, what are the career options? What is the prospect? You can work as educators in clinics and hospitals immediately after your internship as part of your diabetes care team. And you can also self practice because now there is an increasing demand for these educators because many old people are living alone and they have a big confusion about insulin injection and medications and all that, and you can do help them by providing education services, and also you can start educator clinics and mobile services, or many of the boys can do that. Now they are doing like they go for home consultation, and you can start startups, entrepreneurship, and also IT sector and biomedical research. There are options for these trained diabetes educators. And pharma companies absorb many of them for training as well as for their further courses. Now, if you don't want to work immediately and go for further studies, there are options available in health analytics, artificial intelligence, and data management. And there are interdisciplinary studies like Ayush. Will consider this as a basic degree for further studies. Now that is coming up in a big way with a lot of, they offer a lot of courses. And in some other systems also, this degree is valid for going to further studies. All these informations I have collected from a specialist in career guidance called Dr. Sethu Madhavan. So I'm just sharing it with you. I'm not an expert on this area. Now, what are the prospects abroad? Because now most of the students wants to go abroad either for further studies or for their career. So UK, USA, Canada, this degree is recognized, and you can take up as a skilled worker or technician, as a technician or supervisor in healthcare sector itself. And in management level, you have to do some licensing exams or courses there to get into the management level. But many of the countries are appointing these graduates as a community level healthcare worker. If you have a good proficiency in English, you can go ahead and do this. And and you can also pursue any graduate programs in the world. And you need to get a TOEFL and GRE for score sufficient for USA or IELTS for rest of the world. Now, just one word on one slide on MSc Diabetes Science. Here, the eligibility is passing Diabetes Sciences course. So that means those who are passed in our institute are only taken, and the selection is made on the basis of academic scores and performance and the personal interview. Duration is 2 years. And after MSc, what you can do is you can be a faculty in allied health sciences. And now that's coming up as a separate wing. And so there will be more opportunities. And pharma companies take this MSc past person as trainer. That is to train the educators which the company appointing and to train them. And also you can pursue further studies as a junior research fellow, and you can go ahead and do a PhD with after these MSc courses. So I would like to share some um, um, experience from those who are passed out with you. I hope the audio is audible.
No, it's not audible, ma'am.
I'm sorry. I don't know what's happening. It's audible for me. It's not audible there.
No, it's not audible for.
1 second. I'll share again with that option of um,
Okay,
voiceover. Okay.
okay, okay.
I'll try again.
Okay, ma'am.
Bachelor's and Masters in Diabetic Science from
Audible?
Amrita.
Yes,
After
yes.
graduation, I have joined in Astra Mims Kannur as diabetes educator and later on accepted the lecture post in AIMS. I could proudly say that I have witnessed the growth of our course as we were the first ever BSc Diabetic Science batch with 4 students in total. We four were able to acquire our positions as diabetes educator in hospital as well as company sector. The demand of diabetes educators are projected to increase because of the increasing number of diabetic cases these days. Moreover, I think challenges limiting the diabetes education, such as poor understanding of what diabetes educators do and underutilization of diabetes education, continue to redress. So, thanking you for letting me share my experience, and I wish the future is awaiting for more diabetes educators.
Hi, I am Bhanupi Prakash, currently working as Diabetes Education Medical Trust Hospital, Kochi. I had my bachelor's in diabetes science from Amrita in 2019, and thereafter I joined a pharmaceutical company with a decent pay. So we were the third batch with 4 students in total, and we 4 were enrolled right after our graduation. So having gained an experience of 1 year in the company, I looked out to hospital sector for more exposure. You could also pursue your postgraduate degree in the same, but I chose to work. So I would say that choosing BSc Diabetes Science for my career as well as for my passion worked perfectly well for me. Um, Initially, we had some difficulties, as in where people didn't regard us because they weren't aware of the job title or the role we did in their lives. But gradually, we become a part of the healthcare sector with the more people approaching us with hope. And overall, I am satisfied with our role in helping patients manage their diabetes carefully with ease because providing technical support, clarifying their doubts, and above all, being emotionally available for them is something not all can do. So I, as a diabetes educator, is proud to have reached where I stand today. And thank you for letting me share this. And I hope that our course and our role in the hospital sector will reach out to everyone because I think there are still people who are not aware of us. Thank you.
Am I audible?
Yes, ma'am.
Okay. So that's all I have to say. That is, it's a health sciences degree from a world-renowned university, and with this degree, you can serve the humanity, actually the ailing people, and you can survive in this world with a decent pay, and you can save and see the world and go for further education or a career right away. So I think um, those who have an interest in this field, this is definitely a very good option. Um, I can answer any questions if there are.
Okay, ma'am. We will just check. Anyone who has any doubts can now ask. Madam could clear it for you, or you could even raise hands. Ma'am, let us see, maybe they will come up in between, but for another 2-3 minutes, we have Aishwarya who will be telling us about the admission process this year.
Okay.
Aishwarya.
Thank you, ma'am. Good evening, on and all. I am Aishwarya KS from Amrita Admission Office, Kochi campus. So I'm here to explain you about the admission process for the BSc Diabetic Sciences for the academic year 24. I will share you the screen. So the duration of the course is 3 years plus 1 year internship. The age criteria is that the candidate should be minimum 17 years of age and maximum 23 years of age as on December 31st of each admission year. The candidate should secure 60% aggregate marks in physics, chemistry, biology, and English. The selection will be based on the rank obtained in the Amrita entrance examination, that is AEEL. The counseling will be after the allotment of seats. When coming to the fee structure, the tuition fee for scholarship category is rupees 90,000 per year. For non-scholarship category, it is rupees 1 lakh per year, and for NRI, it is in USD, that is 2,500 USD per year. And the other fees and hostel fees are common for both for all the categories. The other fees is 37,150 per year. The hostel and mess fee is rupees 68,000 per year. When coming to the CSAP registration process, that is centralized seat allotment process, the AL results will be out soon. So the candidates have to register for the centralized seat allotment process for AL 2024 to participate in the online seat allotment process. The registration link can be seen in the AOP dashboard after logging in. The link for CSAP registration will be published along with the publication of the ranks. The candidates should enter their marks, that is your +2 marks. You can upload the mark sheet in the portal, and you can submit their academic preferences before 31st of May, and you can uh, you can upload your interest. That means you can upload your application preferences like interested programs and campuses. And if you have any queries or inquiries related to this, you can mail us at ug@admissions@aims.amrita.edu, or you can contact the following numbers. Please note that if you are willing to apply for any allied health science courses at Faridabad campus, you can apply now in through HSC mode. And please note that Amrita Vishwavidyapeetham has not appointed any agent or third-party client for securing admission in any program. Students are hereby requested to contact only the toll-free number on our website for any admission-related queries. Thank you.
Thank you, Aishwarya. I think there is someone who's raised hands. Hakeem Abdul, do you need any clarifications? Yes, one attendee. Anyone? Martin? Martin? You could unmute and speak. Martin, are you there? I think he just raised his hands, but then. Okay. So as Aishwarya said, regarding the admission process, we may be having the results today evening or by tomorrow. So all be ready for being candidate to Diabetic Sciences. You heard, ma'am, how well she presented the whole features of Diabetic Science. It was so clear and beautifully explained, ma'am. It was so clear to all of us. There leaves no doubt why candidates should really choose Amrita, because we have such expert faculty, such expert doctors like you who could train them to what they have to be and motivate them to get a better future. So this webinar is really so interesting because this is so common for any one of us to know that how we should maintain or how we should understand about diabetic sciences. And we really did not have such kind of a general knowledge from anyone else. And as you said, madam, I think I will talk to the AOC and also try to um, increase the mass extension of this diabetic sciences course in Amrita, which you said or which you are unhappy with has not uh, proceeded to many. But anyway, I'm happy today. We had a lot of attendees today, 35 or 36 of them in the initial stage. We were listening to you. And I think once you stopped, they left here because they knew they have got all that they wanted. So I'm so happy to have you with us today, ma'am. And I wish each one of you who attended this webinar would have surely got enlightened with what madam had to tell you all about the sciences. And we are sure once the result is out, you would really opt for Amrita, and you understand why Amrita, being a deemed university and a world famous university, you should make a choice with us. So I wish you all the best, and we are all ready to welcome you. Ma'am, once again, I'm so
Thank you.
happy to thank you for being with us during the webinar till the end now, spending your precious time with us. Thank you once again.
Thank you.
And
All
thank
the
you all the
best.
attendees who have joined this webinar today. So let me wind up this webinar today for now. Thank you.
Okay. Thank you, Priya. Thank you, Aishwarya. And all the best to all the candidates.
Yes.
Probably will try, hope to see you in Amrita.
Yes,
Okay.
yes, yes, ma'am.
Thank
Thank
you.
you so much,
Bye-bye.
ma'am. Thank you. Bye.